Good afternoon, everyone. Please continue to put your name and where you're from in the chat. We're going to be getting started now. My name is Robin Mockenhaupt. I'm the Director of Policy and Advocacy for Virginia Funders Network. Welcome to our fourth annual Post-General Assembly webinar. We're really pleased to have everyone join us today. We have a terrific program ahead of us, and we're looking forward to hearing from our two outstanding speakers and also from all of you. So just as a reminder for those of you who either have joined these post-General Assembly sessions before, or if you're new to them, please think of questions for our speakers. We will have our speakers each present first, and then we'll have time at the end for questions and answers. And you can drop those Q&A in the chat as well, and we'll be sure to get to all of them. So the purpose of this session every year is really to highlight the legislative session that has just ended in Richmond, and that is indeed what we're going to be doing today as well. The timing of our session today is very interesting. For those of you who track the General Assembly calendar, you know that the legislative session ended last month and they will reconvene next week. It's always difficult to try to plan exactly the right date to have this post General Assembly session where we have as much information as we can to share with you. So we are in the midst of the legislative process still happening. And in some ways, it's a really great opportunity to talk today about exactly where we are in the process and what is you as funders and VFN members can be thinking about, keeping track of, and getting involved with over the next few weeks and through the rest of the year. So just so you know, our speakers today, just because of where we are in the process, may or may not know the answers to questions, but I know they will do their best to tell you what they know right as of this point. So as I mentioned, we're really happy to have two terrific speakers with us today. They're both incredibly accomplished. They share some common experiences in their past, and I will let you figure that out after you hear their bios. They both have worked in both the public and the private sectors and are familiar and very actively engaged in many ways in the social sector with nonprofits as well. So our two speakers are Secretary John Littel and Fran Bradford, and I'll introduce each of them and then invite each of them to speak. Secretary John Littel is Secretary of Health and Human Resources for the Commonwealth of Virginia. In this role, he leads the 12 state agencies that deal with health and long-term care through Medicaid, independent living programs for seniors and disabled persons, and public health and child welfare. He also leads Right Help Right Now, Governor Youngkin's initiative to transform our mental health and substance use disorder system. And you're going to be hearing a little bit more about that initiative in Secretary Littel's comments. As I mentioned, he has previously worked in both the public and the private sector. He was appointed to the Board of Visitors of the College of William and Mary in 2012, and he served as the rector from 2018 to 2022. He serves on a number of boards, including the Gloucester Institute, a leadership institute for young African Americans. He's previously served as the chair of the board of one of our own members, Virginia Healthcare Foundation, and on the boards of the Family and Children's Trust Fund, Virginia's Family Violence Prevention Agency, and For Kids, a program for homeless families in Hampton Roads. One fun fact you should know about Secretary Littel is that he loves ice cream, and during the Q&A, you can ask him what his favorite flavors are. So welcome, Secretary Littel. Really delighted to have you with us today. Our second speaker is Fran Bradford, who is the Senior Vice President on McGuireWoods Consulting Virginia Government Relations Team and National Education Practice. Prior to joining the firm, Fran served in the Education Secretariat for Governor Northam's administration, first as Deputy Secretary and then as Secretary of Education. Before her appointment to the governor's cabinet, Fran also spent time with William and Mary, where she first served as director and then the associate vice president for government relations. And she was responsible for all of the state and federal government relations activities. She's also previously worked in a number of different jobs at CHEV, the Commonwealth's Higher Education Coordinating Agency. And you're going to be hearing about education and workforce related issues from Fran, among other topics. So Fran also has been involved in many different nonprofit organizations as well. She serves on the executive board of Virginia Network, an organization that promotes women's leadership in higher education, and the Education Commission for the States. She also serves on the board of the Science Museum of Virginia, the Richmond Public Library Foundation, and Virginia 21. And a fun fact or facts that you should know about Fran is that she loves Disney World and Lego. So again, during the Q&A, you can find out more from her. So Fran, welcome. We're really delighted to have you. So as I mentioned, each speaker will speak together and then we'll have a Q&A after that. Each speaker will speak for about 15 minutes or so. First, Secretary Littel talking about health and behavioral health and substance abuse issues. And then Fran talking about education, workforce, housing, and other related issues. So welcome to both of you, and I'll turn the floor over to Secretary Littel.
Thanks, Robin. Let me just get my screen set up. And I am embarrassed to say this does not happen frequently, but I am embarrassed to say that I actually had ice cream 30 minutes before we started. So I'm either on a sugar high or I'm going to take a nap in the middle of Fran's presentation. But so thank you. And you can see my screen. Okay, great. Well, I thought I would, I really appreciate being here, and I've worked with many of your participants, obviously with the Virginia Healthcare Foundation, but many of you out in the community. So I thought I would zoom through a bunch of areas and speak really fast. But I thought we could just do a little on where we are in the session, and certainly Fran can give a much broader perspective on that, but I'll talk specifically about where we are in healthcare, and then a little bit about our behavioral health transformation, where we are, where I think you all can be participants in that, healthcare workforce, and then I'm sort of using community health as sort of a bucket for a lot of things that I think are really important for us to collectively be thinking about. So I think if you hopefully have read the papers, you know the governor introduced around 230. I would say, you know, the first thing to consider is that in the governor's introduced budget, which was the first budget, in the conferee's budget, the second budget, in this common ground budget, the third budget, and then there will be a fourth budget or not, done really well. So I think everyone, a lot of the things that many of us care about have been funded and have been continued to be funded. So it's very important. A lot of our growth comes from a couple of things. Number one, a lot of the programs that we have that are big programs, Medicaid, some of the other assistance programs had a lot of federal funds during the pandemic. Those ran out this past year, this current year as well. And so, you know, in particular, we have been redetermining all the 2.1 million people that are on Medicaid today as the federal funds that came with the COVID went away. And so a lot of the increases that we have relate to that. But there's also some areas that have been really important that we focused on. One of those has been funding waiver slots for individuals with developmental disabilities and making sure that we have services and providers to do that. And that has been a priority of both the governor and the General Assembly. So that has been a real collective common budget, $169 million for other behavioral health programs, as well as a number of other parts of HHR. So, you know, looking precisely or specifically at Right Help right now, And I'll talk a little bit about this, but we're kind of continuing the work that we started in crisis services, the crisis service infrastructure out in the community, workforce in general in healthcare, but very specifically in behavioral health has been a priority. And then thinking about how we address the opioid use issue across the board is there. Many of you participate in the Children's Services Act, and that program continues to grow. And so we had to put 97 million in for that. One big initiative of the governor and supported by many members of the General Assembly has been to really lean into kinship care and to make sure that before we put a child into foster care, that we look for a family setting and that we provide support to that. In the past in Virginia, we didn't provide support for children who went into a family relationship. And so whether it's financial support or emotional support, training, whatever it is, to just make sure that we do that so that we can sort of reduce the number of kids that go into foster care. Virginia has been around 47th nationwide in permanency of placement, which means that a child placed in foster care will likely not stay in that placement. And many of our children age out of foster care without a permanent placement. And so that's a really important thing for us to focus on. There are a number of other parts of this. Some of them are sort of internal. Upgrading our entitlement enrollment process is really important. Looking for how we support community health programs. And then we have been reworking the way that we support emergency medical services across the Commonwealth. And we had to put some additional funds in for that. So I want to go right into behavioral health. And I think, remember, where we were. So this is kind of where Virginia was coming out of the pandemic. And I think, a lot of work has been done by many organizations to look at this. But, I think it's really important when you look at Virginia, we're really, every part of Virginia has a shortage of mental health professionals in some way. The places that are light blue, Northern Virginia, right around Richmond and Tidewater, they're not much better. The demands there are pretty significant. But you can see that, 33% of our population lives in counties that are mental health professional shortage area. Virginia Healthcare Foundation, for one, has done a lot of work in assessing that, and that really helps us guide the programs that we have, whether it's behavioral health repayment programs or things like that. We have 5 counties that have no pharmacy. We have 33 counties where there's no one that can prescribe a psychiatric medication. So there's a lot of issues. When you think about just mental health in general, we're not where we should be. We're at the bottom of the list, and particularly when you think about youth mental health. So these are data points that come from data from the end of the pandemic. So they will clearly go up, but really a lot of really across the board. And I think you all know that in your own communities, there's the level of anxiety and depression and loneliness that's driving a lot of demand on the system, and really thinking about how we redo that. So the governor's, in my secretariat, the signature effort has been Right Help Right Now, and that we're fortunate that we're in a place where, one, there's a lot of bipartisan support for this, but more importantly, we're building on a lot of good programs that have been put in place over the last 5 to 10 years. And so STEP Virginia, the arts program, Bravo, a lot of things that the state and the private sector have done in the community that can be really helpful. But when we looked at the whole continuum of care, when we looked at the way that people were being treated, our system really focuses more on institutions and processes and not on the people that we serve. And so really thinking about how we do that, and which areas we can really build out. So the most important thing is just thinking about how do we build out this crisis infrastructure that doesn't exist, so that we can prevent people in need from going to a hospital. And so what we're trying to do is, we're using a best-in-class program called Crisis Now. And where we want to be in 2025 is that we have mobile crisis units that will go to someone's home or office when they're in need. That there are crisis receiving centers that people can go to for 23 hours or less to get psychiatric or substance use response care. For people that need more service, they can go to crisis stabilization units. And then looking at ways that we can rethink how emergency rooms in hospitals treat people with psychiatric issues. And the whole point of that is really to make sure that we are responding to people where they are, that there's someone for them to call, someone who's going to listen, and somewhere for them to go. And when we do that, we can kind of reduce the law enforcement burden, which, right now, a lot of the people in need end up in the criminal justice system, which is really difficult for people to get out of. So that's an area that's really more, a lot of the programs that we have, whether they're workforce programs or other things, relate to growing more capacity and doing that. And then the other part of it is just looking at substance use disorder, and particularly opioids, and thinking through that. We have the opioid um, um, committee where we're using our opioid abatement authority dollars across the board and in particular communities, but making sure that we're leveraging those dollars to ensure that we're preventing people from overdosing, but also looking for ways that we can treat them and bring them back into the community. We believe in recovery, and I think that's really important that we understand that people who are in recovery are in recovery forever, and we need to make sure that we support them, and whether that's support them in treatment, whether it's in housing, whether it's in other services, it's really critical that we do that. And the last thing, and I'm kind of speeding through this, is looking for ways that we can bring innovation into our system and really thinking about what are the best practices of other states and other communities that would make sense here. One of them was to re-procure our Medicaid managed care program, which covers about 2 million people today, and to make sure that the managed care program really has an emphasis on behavioral health, that it serves people with foster care issues in a different way, that we look at ways to improve maternal health care and things like that. We had a lot of bills that went through the General Assembly on this. This is just some of the bills that relate to right help right now and thinking about that. And a big part of this, when you're thinking particularly about illegal drugs, fentanyl, other drugs, is that the technology continues to evolve. So last week we had a signing ceremony for a bill that prohibited the use of pill presses, where we have a large number of fake pills that are coming in that are fentanyl or fentanyl laced, that are disguised as Adderall, as aspirin, as Percocet. And, right now we have 5 Virginians die every single day from opioid overdoses. Many of those, we call them opioid poisoning, meaning they thought they were taking a different pill, and the tolerance is very low. So if you think about fentanyl, when you hear about a fentanyl seizure by the police, it takes 2 grains of fentanyl to kill an average person. So 2 grains the size of salt. And so when you hear about a pound or 40 pounds or whatever comes in, recognize 40 pounds can kill the entire population of Virginia 2 times. And so we're really fighting a pretty significant challenge as it relates to drug trafficking organizations and things like that. And so continuing to look at ways that we can do that. I sound more like I'm doing public safety, but it is really important that we kind of do that at the same time that we're looking at ways to educate people and provide treatment. On workforce, a lot of things have been going on for a while, and we're continuing to lean into those, as well as doing more things. We have been focused since the beginning of the administration on nursing and looking for additional ways that we can get individuals into nursing programs. Nursing is an incredible career path, and it is a great way out of poverty. And so looking at ways through the public sector, through the private sector, to do that, there will always be the need for nurses. And so that's a great opportunity. And then, looking for ways that we can improve the behavioral health workforce. We had a bill that will create a behavioral health technician so that we can put more people trained in behavioral health into schools and local communities, to really meet the needs of those individuals. We have been really working hard to streamline our own licensing process, to shorten the time frame, to make sure that people can get through that. We tried to pass a bill for universal licensing for healthcare. Instead, we got a work group, so we'll have a lot of opportunity to bring people in. But basically, it would say that for most healthcare occupations, if you have been licensed in one of the other 49 states, and we're aware that that license is consistent with ours, that you can just come into Virginia with a pretty simple process, just to make sure that we are inviting anyone that would like to practice in Virginia there, as long as they, meet minimum requirements. Across the board, we believe in that we have to have targeted loan repayment programs and scholarship programs to get into these professions, and in particular to look at how we can do this from so that we have a more diverse workforce. So we have a lot of issues. We have many ethnic and racial groups in Virginia, so it's really important that our healthcare workforce reflect them, but also thinking about geography and making sure that we have healthcare professionals on the Eastern Shore in Southwest Virginia and Fairfax, and do that. And I think one of the things that many of us have been talking about for a while is just how do we rethink the whole healthcare workforce pipeline? And, one of the things when I think about when I was in school, or even when I was a deputy secretary 30 years ago, we were targeting high school seniors and college age students to talk about healthcare professions. And today it feels like you have to do that with kindergartners, right? It's very competitive. And I would say we definitely want kids to be kids, but we also do want to help people understand the wide range of occupations and careers that exist in healthcare, and really make sure that the pipeline that we need, or the pipeline is going to give us the workforce that we need. In community health, I think there are so many of you are involved in them in your own community. Maternal health continues to be an opportunity where, it really feels like in many ways we should have solved. I mean, it does feel like we should have solved this a long time ago through technology, through training, but our numbers are still much higher than they need to be. I'm excited that we're in a place where we can really use data to try to understand why women, and particularly women of color, face challenges related to mortality, to morbidity, and make sure that we're targeting our programs towards them. So I think there's some opportunities for us both in the budget and some existing programs that we have. We certainly recognize the value that community health workers, and so looking at the ways that the health department, hospitals, other people are interacting in the community, really goes a long way. I mentioned the Medicaid reprocurement. I think that's going to be really helpful. Many of you are involved in programs related to social determinants of health, and certainly more than anything, I think we have become aware of the importance of food security and housing, whether it relates to mental health or health. And I really stepped in to help create opportunities and be innovative about how we do that. I mentioned kinship care and foster care. I have health literacy on here because, I see this particularly in mental health, that, a lot of us know if something goes wrong, you call 911, or someone that can help you out. But many, many people just do not know how to approach and utilize mental health services. And I think we have a great opportunity to really help people understand both health literacy and mental health literacy. And, to me, that's a key to wellness. By helping people become literate in this, we create agency for them. We empower them to be a participant in their health. So I think there's some real opportunity there. I think there are a number of things that you can help. I mean, first off, many of you are involved in great programs at the local level. I don't think that the state or the communities could operate without you. So I appreciate that, particularly the funders that are conversion members. Many of you have either participated or led community health assessments, either for hospitals or local health districts. Those are incredibly critical. That's how we assign resources. I think that's really important. I mentioned youth resilience. I think that, one of the things that I would love to be in a place is that we move away from talking about this as a mental health issue and we start to think about resilience and well-being. And well-being to me is much more positive and broader way of thinking about what we need. When we talk about that, not necessarily your issue, but to me, the single greatest threat to that continues to be social media. And I think we see more and more every day, we see studies and we see analysis that show us the impact that social media, the algorithms, the addiction tools are having on young people, particularly on young women. And I think, there's a lot of work that we need to do there. Um, uh, there are some great workforce development programs in certain regions of the state and certain localities. And I think that when you get to the place where you have local leaders that are identifying needs and that are using both state resource, private resources to create programs, that's really going to help the area. I do know I talked to one funder. When you look at how do you keep a healthcare provider in a community, um, it's not a surprise, but the two areas are they need to be in a relationship and they need to have a mortgage. And there were many times where hospitals and other organizations provided those mortgages and kind of got them there. So I think if any of you want to start a dating app that will keep doctors in places, I think that would be really important. Fran is an expert, so she's going to talk about this, but I will tell you that, one of the things that I observe is that, and this is an area where you're helpful, not just in the General Assembly, but every day, and that is with a one-term governor and a part-time legislature, it is really hard to do a lot of things over a long period of time that require a lot of attention and a lot of resources. And so can't really change having a one-term governor. But the probably most important thing is that you work with your local General Assembly members, help them understand what's going on, particularly the health needs in your community. We do not have many members of General Assembly that have any healthcare background, very few. So it's really important that we help them understand, what the specific needs are. And the last thing I'd say, and it's kind of a new one, is just we have a tremendous amount of data and we have a lot of best practices. And I think one area that not many of you support is research. And I think there's some real opportunities as we go forward, both in an academic standpoint, through organizations like the Virginia Center for Health Innovation, other opportunities to just support that. And then the last thing is I will make a plug. Every year, the governor has to appoint 800 people to boards and commissions. Everyone thinks it's a fantastic patronage job for the governor to do. It is a nightmare. And in my secretariat, I have 164 of those and boards. And so there is a board for whatever you are interested in. And I would hope if you could sort of go online. The Secretary of the Commonwealth has a website and you can look by secretariats, you can look by agencies. Some of the boards just require citizens, others have more specific needs, but it's really important. And I would say it's especially important if you don't live in Richmond, because if we can find people from Bristol and we can find people from Chincoteague and we can find people from Winchester, that's really going to create a much more diverse experience for us. The General Assembly continues to make it easier for people far away to participate by allowing us to use more virtual resources for that. But if any of you are interested and want to talk further, the contact is in the bottom. I'm certainly willing to talk to you about that. And I look forward to answering any questions as we go forward. And I will turn it over to Fran, who, as you note, I have known for many years, and she knows far more about the process and the players and the people than I ever will. So you're in good hands. So thank you.
Thank you so much, Secretary Littel. Fran, we turn the floor over to you.
Great. Thank you. And thank you, Mr. Secretary. I will do my best on the technology side. Do want to say thank you for including me this afternoon. The work that you all and your organizations do is just sort of critical to the health, safety, and happiness of Virginians, and really grateful for all of the work that you do. When Bess asks me to do something, I always say yes, sometimes before asking what it is. And in this case, when they told me I needed to talk about healthcare, I said, that's not my area of expertise. Could you get me some help? And they got Secretary Littel. So I think next time I need help with something, I'm going to ask Bess and her team to help with that, because clearly that's the best help you can get. And there are plenty of people on today who know more about some of these issues than I do. I'm looking at you, Debbie Oswald. So I'll do my best, but also happy to phone a friend. Really wanted to just sort of go through and touch on a few things that the secretary touched on, and then talk a little bit about some key issue areas, largely related to education, workforce, and housing, and then just sort of look ahead a little bit. Um, just as a reminder, looking backwards before we look forwards, this was a historic election here in Virginia, and I know you all talked about this a little bit in your earlier session in the fall, but a reminder of how new so many members of these committees are and the bodies are, and with the switch from the Republicans holding the House to now the Democrats, there is that has engendered a number of responses, including who chairs committees, how many members are on each committee from each party, who controls the legislation, whether it comes in committee and on the floor, um, and then also sort of the legislative side of the budget process, which the secretary touched on a little bit. And then he also sort of touched on the appointments to key commissions and boards. The legislature also gets to appoint a number of folks to these commissions too, not as many as the governor. And I absolutely support and encourage you all to follow the secretary's guidance to think about joining on some of these. Um, just as a reminder of where we are in the process, you can see the little "You Are Here" logo, as if you were in the mall trying to find a store that isn't there anymore. But we are sort of at the tail end of the budget development process. That starts, early in the summer, in July. The executive branch, the governor and his team, and Secretary Littel put together the budget that they share in December. The legislature gets it for 2 or 3 months. They do their thing. They produce the conference report, which the secretary referred to. And then the governor gets an opportunity to offer his amendments to that version of the budget, which is what he did on Monday. And then we'll talk about this in a minute, but they then, will address those proposed changes next week during the veto session. But it is a lengthy process, and you can see pretty much that as soon as it finishes, it will start up again. So sitting on the sidelines is never a good idea if you want to participate in the budget development process.
Fran, this is Robin. If you were going to share slides, we can't see your
Oh,
slide.
you can't. Okay. Well, they're great. They're really great, by the way.
Thank you.
Yeah. Let me see if I can figure out what's happening. Let's see. Robert, I might have to phone a friend on there because I can see them on my screen.
Okay, we'll pull them up for you. Just you can keep going and we'll get them up in a minute.
Sure. Perfect. All right. Well, talking a little bit about some of the key issue areas, and Robin, the only one that's probably worth putting back up there for them to look at briefly is the one about, sort of the budget process. And then play catch up here with me, and I apologize to everybody. Talking about the early childhood area, there were a number of bills considered this session in early childhood. Most of them focused actually on the workforce side and less sort of on the education side of early childhood. As the secretary talked about related to the healthcare workforce, Virginia, like many other states, struggle with the ability to get early child care workers. And that is where a lot of the legislative and financial focus was this session. There were a couple of policy-oriented bills related to early childhood. A number of them were carried over to the Early Childhood Commission, which has been reconstituted in the last year and is really looking to engage in a much more in-depth way. As we talked about, the budget side, there were some bills that passed that sort of cause us to be thoughtful about looking out 2 years what the child care costs are going to be, and to be thoughtful about that as you develop the budget. There were a number of bills related to exemptions for early child care, including where you can have early child care facilities and also the licensure of the folks who work there. And those exemptions include folks who work in child care facilities in, say, a religious organization. Um, I do think early childhood is going to remain a key issue in the next couple of years, both on the workforce side and on the education side. The Virginia Department of Education has really started to look closely at this, and they fully implemented a new unified measurement and improvement system, which they have rolled out. And that is actually going to begin to collect some data. Again, as the secretary noted, having the data really allows us to be thoughtful about making some of our policy decisions. Um, you can see on the slide, hopefully, that there are a number of additional dollars that have been put into early child care. And the governor's amendments, which we saw on Monday, reaffirms his support for the nearly 70,000 early learners who were previously supported by the federal dollars that came out of the ARPA funds and some of those other COVID resources. Looking sort of towards now going up the age chart here, the K-12 area. K-12 is always a hot topic during the legislative session. I work closely with a couple of school divisions, and it is never boring to try to keep up with all of the things that they are tracking, either from an academic side, a safety side, a health side, and even sort of on the compensation side. And you can see some of the key topics that were discussed this session: teacher and staff salaries. The governor supported the 3% increase that was included in the conference budget, and Virginia is looking to reach the national average on teacher salaries. We are starting to implement the Virginia Literacy Act, which was approved a couple of years ago. That's really starting to look at the science of reading and how kids learn. We do expect in the next couple of years sort of a numeracy act, so a math version of the Literacy Act we expect to see in a couple of years. School hunger is something that they tackled this session, teacher licensure, and again, as the secretary mentioned, on the healthcare side, looking to find ways to get more teachers into the classroom as we're looking to get more healthcare workers into the health facilities. So trying to find creative ways to get quality teachers into the classroom. Mental health and opioid use, again, as the secretary mentioned, is very much on the minds of those at the K-12 level. Special education continues to be a challenge in Virginia and across the nation, how we staff it, and what some of the programs are. And then lastly, on the policy side, I'll note that there were bills that would have allowed a local referendum to impose a sales tax on themselves to support schools. That bill was vetoed by the governor, but of course the legislature will have an opportunity to discuss that next week. On the budget front, there's a lot more money going into the literary fund to support school construction. Those of you across the state know that schools are not in great shape. Many schools, are nearly 100 years old without air conditioning. And so the legislature and the executive branch has been working hard over the last number of years to try to get some money into the system to help offset that. For a lot of small localities, it's really hard to afford, a new 20, 30, 40, $50 million elementary or high school. And coming out of last year, the Joint Legislative and Audit and Review Commission released a report on K-12 funding and the K-12 funding model in Virginia and how it's really sort of broken. And so building upon that in the budget is a joint subcommittee that has been asked to sort of look at that report and make some recommendations on how to sort of address that. The governor supported the teacher and staff pay increases that I mentioned earlier, and he also returned funding for the lab schools that was removed in the House and Senate version of the budget. And to his great credit, and Secretary Gadara's great credit, there are a number of institutions and school divisions around the state that are looking to take advantage of that program. Looking at higher education, Higher education is not often the most hot topic during the legislative session, but there are usually a number of bills that have a significant impact, and this session was no different. Um, Virginia did pass, and the governor did sign the bills which prohibit the use of legacy in the admissions process. Many of the institutions were in the process of doing that already, but very important legislation to take that out of the mix in terms of how institutions are letting students into their classrooms. Um, for those of you who followed college athletics, if you watched on Monday night, or Sunday, even the better game on Sunday, the women's national championship, students in those programs are making more money than they're going to make their first couple of years when they are professionals, and trying to manage how the NCAA and schools and states get a handle on this name, image, and likeness piece is really important. So some legislation happened on that front. I will point out one other bill, which I think is pretty interesting. All of the public colleges have an attorney or attorneys that work for them, but also work for the Attorney General. And a bill would have allowed the institutions to have their own attorneys. That bill likely is not going to survive the process, but it is an important part of the discussion. I'll touch quickly on a couple of items in the budget. Internships, working very hard to increase the number of internships offered on our college campuses, with a goal of having every college student at a public college have an internship before they graduate. Increasing in financial aid, faculty and staff pay raises also are on the table, along with the K-12 faculty and staff. And then some more money in the debt pool to increase and fix some of the buildings on our college campuses. And while the governor did reduce a little bit of funds for the internship program and the military survivors program, both at the moment are slated to have some more resources by the end of this cycle. And then quickly, I'll touch on workforce, and I know we want to get to a couple of questions. As the secretary said, healthcare workforce is a big issue, childcare workforce is a big issue, and just workforce in general, producing the needed workforce. Virginia's growing economy, particularly in Northern Virginia, in the tech sector, in the healthcare sector, and frankly, even in the trade sector, particularly in Hampton Roads for the shipyard. We can't find enough welders. We can't find enough electricians. So continuing to work on that front. Some of the issues related to workforce that came up this session, again, early childhood and making sure we have enough childcare opportunities so folks can get back into the workforce. Minimum wage, paid family and medical leave, the expansion of the free community college program, and as the secretary said, data collection so that we can better understand how folks are making decisions about their education and workforce options. And then some more support for business ready sites. But again, workforce, a big focus of the legislature and the governor. Touch quickly on housing. There were a lot of bills focused on housing. With the changeover in the legislature, we saw a number of bills looking to keep rent gouging from happening, some bills on tenant rights, bills on affordable housing. Many of these bills did not survive and or were carried over for conversation, but I think, we have seen a lot more push on some of them we had recently. Short-term rental bills did actually survive so far in the session, and we'll wait and see how that happens on Wednesday. And then a couple of important budget items related to housing, some more money, significant money for the Housing Trust Fund, additional funds for supportive housing, some additional funds for rental assistance, no new funds for eviction reduction, and no new funds for manufactured homes program, but both of those programs still exist and have some funding in them already. And then just sort of looking ahead, we talked about this a little bit. The governor proposed his amendments to the budget and to bills on Monday. A historic number of bills vetoed, 153, and 116 bills were amended, and all of those will be considered on Wednesday. And the budget bill, should we end up with one, which we are all cautiously optimistic for, that will become law July 1. And then Secretary Littel touched on this, but just talking about how you might engage before 2025 arrives, which is probably sooner than we'd like to think. It's never bad to say thank you. Anybody who worked on any of the issues that you care about, especially when they were supportive of your priorities, just say thank you. Call them, send them an email, handwrite a note. They don't hear it enough. They hear a lot of things that you don't like. They don't often hear thank you. Also, let them catch their breath. I know we looked at that slide that shows the budget cycle, but folks are tired. Secretary Littel's tired no matter how much ice cream he eats. Folks are tired. Let them get past April. And depending on how the budget goes, let them get past May. But then it's time to start knocking on the door again. It really is. You can't do it too soon. So before you do, be sure to understand the final outcome from the session. Determine who were your champions and who were your obstacles. You can even go back and watch archived committee meetings, get on the road and visit people off session and listen to them. Sometimes it's better to just listen and then go back and talk to them a second time to share your thoughts. Start developing your legislation and your budget priorities, no later than midsummer. June is, ideal. Start to engage folks like Secretary Littel no later than mid-August. They're starting to put their ideas on paper even before that. Engage members and their staff in the fall, and keep your coalitions engaged, informed, and armed to help when needed. You don't want to call on them if you haven't talked to them since the end of the session. So again, thank you. Keep folks involved and get on the road and go and listen. And that is what I have. Look forward to any questions or comments that Secretary Littel will be happy to answer.
Thank you. Thank you both, Fran and Secretary Littel. That was a fabulous presentation by both. Lots of information. So now is the time for all of you to ask questions, comments to our two fabulous presenters today. So I don't see anything in the chat, but please do put questions in the chat, comments that you'd like to make. And if anyone would like to, you can raise hand or let me know that you'd like to make a comment, please do. We have two terrific resources here today.
And Robin, I think you will make our presentations available to folks too.
We absolutely will. The day after we send out the presentations and some additional resources that we'll provide as well. So those will be going out tomorrow, as well as a recording of the session.
Perfect. I'm very happy to answer questions, except from Debbie, who will ask me things I don't know the answer to.
Me too. I will, while you're doing it, just I think it's really interesting. The governor said something at the beginning of session. So they introduced around, Fran, you probably know the precise number, around 2,700 bills. So each year they keep adding a little bit more. And remember, we have a 60-day session, a 45-day session. So of those 2,700 bills, 1,046 passed. So roughly like almost a 39% passage rate. If you think about it, now I know it's, apples to oranges here. Congress, which is a full-time legislature with lots of expertise and committees and stuff, they pass between 80 and 90 bills a year. Now, granted, they're big bills and things like that, but if you just think about the pace, it's just really remarkable.
And Robin, I've tossed into the chat. I'm guessing most folks on this call are familiar with VPAP, the Virginia Public Access Project.org. They keep track of all campaign donations, all elections. They have a number of visuals which sort of help you understand what happened this session, last session, who's in charge, who isn't. I encourage folks to use that as a resource after this call.
Thank you so much. We are a big fan of VPAP, and they actually spoke at our pre-General Assembly session. So thank you for that, Fran. All right, so now we have some folks who have questions in the chat. So here's a question for Secretary Littel. Can you update us on the status of the statewide workforce agency?
And actually, I would send that over to Fran because we were talking about it right before it, but you can sort of tell everybody where we are on that, and then I can tell you about our participation in that.
Yeah, I'd be happy to. I bet that's a great question. I think we touched on it briefly. The legislation actually passed last session, session before last, I believe. And I give this governor great credit. Something that complicated, where you take so many different agencies and programs and put them under one roof, normally doesn't happen easily and in its first session. But they did get that across the finish line. And Carrie Roth, who is the new head of that agency, is doing yeoman's work. They have that agency up and running 2 months early. They've largely staffed up. And with a very few exceptions, they have picked up most of the workforce programs, federally funded and state funded. And they are now housed under this one agency. A couple of exceptions are, there are a few things still at Chev and at the VCCS. But largely they have collected all of these things around the state and are working very closely with VEDP's agency of the Education Economics, which houses a ton of data to help them make some really smart choices. So I think this workforce agency is going to be a really powerful tool for Virginia going forward for the foreseeable future.
Thank you for that. There's actually a follow-on related to workforce. So for either of the speakers, are you looking to philanthropy to help co-fund specific workforce development programs? If so, who should we reach out to? Thank you very much.
So I think yes and no. I mean, no one's going to say no to funding, so I don't know that it is much of funding. I think what's really helpful is we have some examples that are kind of based on like the Go Virginia model, where we have regional kind of collectives where people, often led by a major hospital system, are sort of the leader, but it's not just for them. And I think it's really important for local organizations to be part of that, to help understand, where the holes are, what might be helpful. And in particular, if we have places where there really are people who do not, because of financing, cannot get into the system, I think there are ways either through the state or through private financing that we can do that. So I think I don't have a specific request. I think for me, it's more expertise, but I do think as we go forward, looking for innovative programs is really helpful. And I would throw it back. I mean, as Fran noted, Debbie probably knows more about this than I do. So if there's something that you would add, you might want to do that.
And
Awesome.
Mr. Secretary, I would add to that too, for folks who don't regularly stay in contact with their local community college or their local higher ed center. That's a great place. And Bess is shaking her head as a former member of the staff at J. Sargent Reynolds Community College. Those are great places to have conversations about workforce development. They're always looking for partners, and they have regular partners with the business community, but great to be connected to the organizations as well.
Yep.
And Mr. Secretary, I see that you also put a link to the special advisor for the governor for healthcare workforce in the chat.
Yep.
So thank you so much for that.
Yep. Jim Jenkins.
Great, thank you. Debbie, I see your hand, and then we may wrap up after that. So please share.
Well, I'm just going to encourage everyone, as John and Fran have, to engage locally. My guess is that many of you already are, but I just think that we learn a lot when we engage with the various stakeholders, and it often gives ideas for things, initiatives that we can do locally. We don't need to wait until somebody comes to us with a proposal, and I realize many of you don't sit around and wait for that to happen, but that is sort of the easier posture from time to time. And I think that I know so many of you, my local colleagues, have your finger on the pulse of what's going on locally, but I just think the ideas bubble up that way, and different initiatives that you could help seed, or that might complement your current portfolios or give you ideas for future directions. So I have always found that kind of thing to be very helpful on the state level and also regionally and working with a lot of you in your areas.
Great. Debbie, thank you for sharing that. Great advice from you and from our two speakers. And with that, I want to thank all of you for participating today. And I'm going to turn it over to the CEO of Virginia Funders Network, and that's Beth Littlefield, to wrap us up. So, Beth, thank you very
Well,
much.
Thank you, Robin. And I want to thank everybody too for participating, and a special thanks to Secretary Littel and my friend Fran Bradford that I've known for a very long time. We won't tell how many years we've known each other. So if she called me and asked me, I would also not say no. I'm really grateful for today's I think it was a wonderful, rich presentation, and we will be eager to hear what happens over the next, hopefully next week, and a little bit of time as the General Assembly and the governor work together to make sure that Virginia has a budget. I do want to remind everyone, I think there were some things in the chat. We have a very robust agenda for the conference. So those of you who haven't had a chance to register, I hope you will. Many of the issues that were talked about today, there is a session on them, and more opportunities to learn about these issues and explore ways to work together and how philanthropy can engage in helping Virginians thrive.